In my view, it is so frustrating, the event of a secondary primary malignancy, SPM, because patients are living longer, the outcomes are now unprecedented, and we all know that the development of an SPM is associated with treatment cessation for myeloma and also inferior survival. So it's really an unmet need to try to predict who are the patients at risk of developing an SPM, so that the improvement that we are seeing generally may also apply to these patients. It's a small proportion, but nonetheless deserve the best possible outcomes that should not be interrupted by the development of an SPM. So with this in mind, we decided to perform a longitudinal evaluation of mutant hematopoietic progenitor cells in the bone marrow of patients with myeloma at the time of diagnosis and throughout treatment, using very sensitive sequencing on sorted CD34 positive progenitor cells. And our results are, I would say, very, very unexpected and surprising. We found mutations in 55%, more than half of the patients. TP53 was the second most frequent mutated gene, and we found high volatility temporal dynamics on the mutational landscape of HPCs throughout treatment, meaning that a snapshot at the time of diagnosis may not be enough, and there may be the need of periodic, frequent monitoring of mutant HPCs. And then we demonstrated that indeed there is a twofold increased risk of developing SPMs if the patient carries mutant progenitor cells, number one, and number two, we showed that indeed we confirmed previous observations that indeed the development of SPM is associated with inferior overall survival in patients treated with the best possible regimens. So therefore I think that this study may help paving the way towards a new laboratory test during patient workup to try to predict the risk of SPMs and eventually fine-tune patient management.